Hi, Dr. Spain. Thank you for joining us again to talk a little bit about the current situation as it relates to COVID-19.
Hi, Andy. Thanks for having me back.
I think the last time we were talking, it was, again, a very different situation, in regards to COVID-19, a situation that is constantly changing and
Mhm.
evolving. So I'm glad to have your expertise on because the last time we were speaking, we were taking steps backwards, it felt like, to respond to Omicron, one of the latest variants that was, affecting us. And now it seems like we're turning another corner in the COVID-19 story as we look ahead to this spring. So I'm excited to have you on and sort of reset and see how we should be thinking about the virus moving forward.
Yeah. Again, thanks for having me. Yeah, it's funny that we're meeting today. It's actually March 9th, the day that we're recording this. But on March 11th, 2020 was the day that the WHO declared COVID-19 a global pandemic. And it was the first designation since declaring H1N1 influenza pandemic in 2009. So talking about turning corners, we know, again, because we've been doing this for 2 years now, people are fatigued, they're frustrated, people are grieving, stressed, all the verbs that you can think of, to describe where people's minds may be. Just due to these near, sometimes daily changes, people are getting, frustrated with what we have to do. So I just want to make point before we really dive in here that COVID-19, the virus itself, has been unexpected from the first time that we started hearing about it from overseas, and just the way that it's developed. Every day, it's constant learning, new evidence, new science that are driving these changes through the public health world.
For sure. Yeah. And I think that that's a great thing to keep in mind. It's always changing. And, just when you think you might be past it, it seems to creep up in a different way. Just this last week, I have a friend tested positive and, had to shut it down. It was, the first nice weekend in Chicago. We were, trying to make plans to go out and meet, on a
Yep.
patio somewhere. And she's like, I have to stay home. I have COVID-19. So, just when you think you might be out of the woods, it can sneak up in unexpected ways. So that's a
Yep.
great point to remember.
Yep.
So, I think a good thing to do as we're talking about that is just to see, how far we've come here and what those, headline metrics are. So, you said this was back in 2020, we identified COVID-19 as, a pandemic. Where do we
Mhm.
stand numbers wise today since then?
Yeah, so we have passed over 6 million deaths worldwide. In the US, we are approaching 1 million. As of this morning, I just looked and we're at 961. So, really, really disturbing news there. Total cases in the US is 79.3 million.
Wow. Yeah, that just staggering numbers.
Yeah.
And, obviously that's part of that is why people are so optimistic and excited to hopefully, take this to the next chapter and
Hmm.
find a time where we can move past COVID-19. However, it seems that, it may not ever totally be behind us, but just in a different way. And,
Right.
what I'm talking about when I bring this up is that there are a few words that get floated around when you're talking about COVID-19. At one point you're hearing epidemic, and another point you're hearing pandemic, and now a word that's entering into the vocabulary I'm seeing in news stories all the time is endemic.
Hmm.
And, frankly, I don't know what any of these words mean any of the time. I just seem to pick up whatever is being said, on the news,
Right.
at that time. So I'm wondering if you can give us a little bit of explainer. Okay, what does it mean to be possibly entering an endemic stage of COVID-19?
Yes. So first we'll go back and just talk about what epidemic means and pandemic, just because I think that'll be good to kind of wrap that up when we talk about an endemic. But an
Okay.
epidemic refers to a widespread outbreak of an infectious disease that spreads through one population or community at a particular time. So a pandemic is going to be a larger scale. So this is when a disease is prevalent across a country, or in regards to a global pandemic, which we hear with COVID-19, it's prevalent across the entire globe. So pandemics are usually caused by new infectious agents. They can be bacteria or viruses, and they spread quickly. So pandemic is a type of epidemic. However, a pandemic involves a greater number of people and impacts a wider geographical area. And it often impacts populations globally. So again, with a pandemic, oftentimes we'll be looking at a global scale. And then an endemic, This is a disease that's always present in a particular population or regions, but at a level that isn't causing significant daily disruptions. So endemic diseases, we have a lot of them, and they can be looked at different levels, such as high, medium, or lower levels, which we'll talk about here in a couple minutes, I assume, when we talk about new CDC guidance. But some will look at an endemic disease as a baseline of what is expected to persist indefinitely. So, or, a certain time. This disease is always somewhere in the population. So some endemic diseases we see are malaria. Here in the United States, we don't hear too much about malaria. However, about half of the world has malaria as an endemic disease in their population. So these are Africa, South Asia, parts of Central and South America, Middle East, Oceania, and then HIV. HIV obviously is a virus most people have heard of, and that's globally present pretty much across the globe. And then influenza. So this is kind of where when I hear people in public health talk about where we are going to be seeing COVID-19 going, that it'll become, it's not the flu, so not viral like the flu, but it's going to become endemic like the flu. So when we look at things shifting to endemic, we're hoping that it's going to minimize daily disruptions. It'd be nice to get these things down to a level where, again, it's always going to be something that is in our population. If you have signs of COVID-19, you would go to Minute Clinic, probably get a COVID-19 test, maybe a strep culture, maybe influenza, whatever testing the provider there thought that you needed. And then overall, just trying to prevent schools from being shut down, where businesses aren't being impacted by large numbers of absenteeism, and overall just getting our supply chain back to where it needs to be. And again, I do want to point out too that COVID-19 has not been listed as endemic at this time. We're still in pandemic, but a lot of the people working very closely with this, scientists, this is kind of where they're thinking that we're going to go. And they've been saying this, gosh, for quite a while. So we're just waiting to hear from the professionals.
Sure. Yeah, it's kind of weird to say that that's aspirational to hope to get to endemic, but after the 2 years we've just had, facing this, I think that would be a welcome change to, like you said, some of the severe stoppages,
Yes.
and life altering choices we've had to make to protect one another
Yes.
throughout COVID-19. And to that point too, you mentioned CDC guidance changing, which I know can be a little bit confusing for everyone because you have to read up on it, and there are rippling effects that happen. Each time the CDC seems to change course and say this is the new way to handle this virus. And I believe in the last few weeks you've seen a lot of these changes ripple out into public spaces like restaurants changing their rules and guidelines around masking and vaccination. Same thing with the workplace, offices, a lot of places that employees have not been back to in quite some time have been tweaking their plans and looking ahead to welcoming more people back. So I'm wondering if you can kind of give us a little explanation around what those CDC changes were and, how they may have led to all these other rippling effects that we're seeing in society right now.
Yeah. So after listening to, again, like the AMA and the CDC, it seems that these recent guidance has been sort of showing us where we would be headed once this is declared an endemic infectious disease. This is what I've heard some physicians and public health professionals say. So again, it's sort of showing us how we could best manage this. And until the guideline change, we focused more on positive cases in the community. This is what we've been doing up till, this recent guidance change. So looking at number of positive cases. Now they're looking more based on hospitalizations. And there's 3 specific metrics that they're going to be looking at. I just want to mention too that the new metrics do not measure an individual's risk of getting COVID. So that's kind of an outside thing, but this is looking more at a community level, specifically county level. So some goals of this are to shift the focus to preventing transmission, limiting severe infection, and reducing strain on the hospital system overall. The metrics are not focused on community transmission or COVID positivity, like I just mentioned. And the CDC is going to be looking at a combination of three metrics. So no new COVID-19 admissions per 100,000 in the past 7 days, the percent of staffed inpatient beds occupied by COVID-19 patients, the total new COVID-19 cases per 100,000 population in the past 7 days. And then after looking at these, making these calculations, they're going to come up with a way to measure communities if they are low, medium, or high. And then it's really cool on the website, actually on the CDC website, there's a tool that you can, put in your own county. But Once you can specify if it's low, medium, or high, there may be some additional steps based on that analysis, which would include layered prevention measures to avoid overwhelming the hospital system. So just to be transparent, when I first saw this, it was kind of even a lot for me to gather,
Sure.
just because it's very different than, before it felt like a snapshot. Okay, we know that there's this many hospitalizations here in my small town and this many positive cases. And it's like, okay, that's really spread widely, throughout this
Hmm.
community. So it is a very different way of looking at it.
And this is kind of, do you believe being done with the level of, like you said, looking at hospital capacity and like what our healthcare system is able to take on? And is that partially because of the our increased ability to not only build immunity to COVID-19, but also having a better understanding of how it works and how to treat these cases? That now we're looking at it as a way, okay, how can we keep communities functioning in a way that also are not overloading the healthcare system rather than focusing on that snapshot, right?
Yes, definitely. And that's what I think has been confusing for people too. We do know that it's still standing that certain populations are going to be at greater risk for hospitalizations.
Sure.
And we have measures, right, such as vaccines that have greatly helped people by reducing those severe cases and hospitalizations.
And let's keep on that. So, immunity is something that we've been striving for, in our communities in a variety of ways, right? There have been vaccinations that have helped that. Unfortunately, the Omicron wave seems to have changed the equation a little bit with immunity, as well as more people were, testing positive with the virus during that wave. So, can you give us sort of an update of where we stand as far as the conversation goes around immunity to COVID-19?
Yeah, so immunity is a really interesting topic, and it's pretty hard to understand if you look at the science of it. But a good thing for the public to be aware of is that there's vaccine based immunity and natural based immunity. And it's just what it sounds like, either immunity from vaccine or a vaccine from a natural infection. The vaccine based immunity is protective against severe disease. Some data is showing that those who had Omicron on top of the vaccine and boosted, me myself, there was a more robust immune reaction. So, and I can't speak to every case of COVID, but when I had COVID a couple months ago, I had been boosted, and I mean, it was very, very, very mild. I wouldn't even
Hmm.
known, except I had to get tested for my workplace.
Sure.
So yeah, so the vaccine is still a great immunity to get. Natural immunity, it's going to provide some immunity, but it doesn't seem to be more narrow. So remember, your vaccine-based immunity seems to be more broad, covering more variants. The natural immunity is going to be more narrow, and it's an immunity to the specific variant that the person had. And the person is still susceptible to other variants with the natural immunity.
I think that is something interesting to touch on too, is because we've all had different journeys through COVID-19, right?
Hmm.
We've had some people who got it right at the start of the pandemic. Other folks who got vaccinated may have had a breakthrough case. Folks like you who during the last wave became infected, and then I will hear people say, "Oh, well, I already got it. Like I checked that box, and that's sort of over." And it seems like that might be not the right way to look at it moving forward as we look to shift the way we interact with COVID-19 in society. Because from what you're saying, breakthrough cases, while they may be a little more rare, they do happen, and there's something we should be paying attention to and trying to test for and communicate to those who may be vulnerable as well, right?
Absolutely. And people can get COVID twice. One of my good friends, a lot of nurses that I know, the COVID basically went through, the whole anecdotally, this whole ICU that she works in. So they've all have tested positive twice already,
Wow.
towards the beginning. And then recently they all tested positive again. So yeah, the CDC does have specific guidelines in regards to, if you've been exposed, I'll just actually read this to you, but if you've tested positive for COVID-19 with a viral test within the previous 90 days and subsequently recovered and remain without COVID-19 symptoms, you do not need to quarantine or get tested after close contact. Um, However, if somebody, even if you had COVID, a month ago and you're showing symptoms, you still would want to be tested. just because you
Sure.
don't know. There's not, and that's how disease is, right? There's not like a definite cutoff when we look at morbidity, mortality, whatever. It's
Hmm.
not, things can run the typical course with people. We can kind of, know what's going on, but we don't know specifics.
Sure, sure. And I think that that's, we're all trying to find our way, as we're moving forward here because, no matter how you've been living, in recent memory, it's about to shift yet again as we're going into another stage of COVID-19. So, finding these ways that, you feel comfortable in order to take on these activities is going to be important, right? Whether that's
Hmm.
doing so with regular testing, whether what your comfort level of masking is, but it also sounds like this is a state that we're trying to get to as a society that's, you said, a little bit more stable moving forward, right?
Yep, exactly.
Well, I think that's a great advice to pay attention to the experts out there, and I know that I hope that the next time I'm talking to you, Dr. Scarlett Spain, we are in that endemic phase, and we are looking forward to an even brighter outlook for COVID-19 because we've certainly had some difficult conversations over the past few years on these calls, and at least this one seems to have a bright side to it, and looks like hopefully we are turning a positive corner. But like we've said, if there's one thing we've learned from COVID-19, it's to expect the unexpected,
Hmm.
unfortunately. So happy to have you as an expert and other experts in the healthcare field to give us a little bit more information and make sure we're following the right advice moving forward.
Awesome. Thanks for having me.
Yeah, thanks. Talk soon.
Bye, Andy.